Don't dare come to the facility expecting to get a service. If you come to the facility, you get registered and then you don't get the service, don't blame anyone. We are reminding you that if you want to seek medical care or medical service, you can seek it from the alternative private facilities. But as of now, the public facilities are closed. Even if you see from the gate, no patient is coming in. We are calling on all class and patients. Come to this facility at your own risk. You will not get the service. Your registration money will go unattended to you. So we are requesting you to stay at home as we fight this cause, so that a nurse who is well remunerated, motivated, will give you a better service. As we are all aware, we have been negotiating for this CBA for a number of times. We have negotiated for this CBA now for 5 times, agreed on it. We've been waiting for the implementation from the government, but the implementation of the CBA has not been forthcoming. That is why we decided as the nurses of this country, together with the nurses of Kakamega County, to come out in large numbers, to go on the streets and demand for our rights. No CBA? No! No CBA? No! The second reason why we went on the streets is because of the failure to implementation of the return to work formula of 2017. In 2017, the nurses of this country went for the strike. We agreed. There are demands that we had put forth. A return to work agreement was signed together with the nurses and the then COG of Governors, Honorable Nanok. Up to date, the implementation of that return to work formula has not been adhered to by our government. We have been very patient for 10 years now, and we are calling for our government. This time round, we are not bowing down. If they don't implement the return to work formula of 2017, no going to work. No return to work formula, no work. No return to work formula, no work. We have our UXC nurses who are employed in the year from the year 2020 during our COVID times. They have been on contract now going to 7 years. We are demanding that these UXC nurses be converted to permanent and pensionable terms. And to prove to that, we need them to be served with the PNP letters to prove that indeed they have been converted into the permanent and pensionable terms. No CBA? No. No return to work formula? No. No conversion of PNP nurse, UXC nurses to PNP? No. The last one, the career guideline progression. This was agreed, discussed by the Public Service Commission together with the Union of Nurses. It has been agreed upon and up to date. The government and together with the COG, they have been unable to adhere to the career guideline progression agreement that was made. These nurses that you see here, most of them have been upgrading in their careers. They have done their degrees. We have those who have specialized, but whenever they come back from school, no one recognizes that such a nurse has been able to go and top up the academic value in his profession. So we are demanding that as nurses of this country, our career progression should be adhered to, and no one at all should come as an obstacle. The Council of Governors, the COG, and the SRC, all we need is a letter of no objection from the SRC for the implementation of our CBA, so that these nurses can go back to work. We are willing to go back to work, but unless our government, the COG and the SRC, put their head together, we are not going back to work unless they sign our CBA, they implement our return to work formula, our UXC nurses are absorbed, and our career guideline progression is adhered to. No CBA? No. No CBA? No.